Welcome to Module 4 of the Little Brushers Guide. Today we are going to talk about toothpaste. Now, for me, toothpaste, the only ingredient that is important in any toothpaste is fluoride. So I know that a lot of parents are completely confused about fluoride. Is it good for them? Does it harm the teeth? And then there are a lot of holistic dentists who recommend fluoride free or natural toothpaste. There is nothing more naturally occurring than fluoride. Fluoride is there in drinking water. The problem is the fluorosis was identified, I want to say about 100 years ago, when they found that people in certain parts of the world had brown teeth, and they found that there was fluoride in their drinking water, quite high content of fluoride, causing what we call as fluorosis or mottling of the teeth. But there are lots of bony issues, skin issues that can happen with that kind of amount of fluoride. Fluoride in the toothpaste is much lesser quantity. It's 1,000 ppm of fluoride that will be there in toothpaste. And of that, one is that this fluoride affects only children when their enamel is being developed. Enamel of the adult teeth develop from the age, especially in the areas, so the front, for all the front teeth, the enamel finishes its formation by the age of 3. So after that, so for adult people who want to have a fluoride-free toothpaste, is because they don't understand why. They don't know what fluoride causes. If you think that fluoride causes other problems like toxicity, even for a child, let's come to this. So let's see. How much of toothpaste do you need? For a child of 0 to 3 years, you need a grain of toothpaste, or a rice grain amount of toothpaste, or a smear of toothpaste, as you can see on this picture, where the toothbrush in front is these are both my sons. One was less than 3 years of age, and the one behind is for anyone. So the pea size amount, that's the adult toothpaste dose, or for children from the age of 3 plus. 3 to 6 years of age, we still continue to use the children's toothpaste, which is 1,000 ppm of fluoride, and from 6 years, when they get adult teeth, they need adult toothpaste, which has got 1,450 ppm of fluoride in most of the countries. And I think that is the most important information, even if you don't take away anything else from today. So there is, like I said, the brown mottling of teeth, which is fluorosis. But what you can sometimes see in children is that they do have these white patches, small little patches of fluorosis, or which you can see on the front teeth. This usually happens when you take a lot of toothpaste, like you see in adverts, toothpaste, the toothbrush head full of toothpaste, if the children do swallow and eat the toothpaste. So again, it's a really good idea to make sure that you spit out all the toothpaste. But if you use the correct amount, so if you use like a grain of toothpaste for children less than 3 years of age, you need to have 8 episodes of brushing with pea-size amount, and you have to swallow all of the toothpaste for it to have any sort of fluorosis. 8 times. Who brushes their teeth 8 times? And which child swallows all of the toothpaste? When it's a pea-size amount, all of the toothpaste. It's not that common. So as long as you understand when and why you should use it. So the age of up to 3 is crucial. The second year is very crucial, when some of the most important teeth, the enamel is forming. So that is the truth with, making sure that, the child is not having any infections. There's no need for them to have any chest infections or anything that requires antibiotics. They are not having a healthy childhood, be it emotionally, physically, mentally, so that all that can affect how, most of the organs are developing, and teeth is one of them. So Fluorosis is very, very a minor problem. I have used fluoride toothpaste for both my children. I've never used a fluoride free, so why would I recommend that for anybody else if I thought it was good for me? There are a lot of holistic dentists who think that it's a good idea to not use fluoride, and they recommend the alternatives like nanohydroxyapatite. Or there's a recaldent, which is ACP-CPP. There is others like TCP, which are all calcium phosphate different combinations and then there's a million others now that's there in the market. Now, most of these toothpastes come as a TCP plus fluoride, recaldent plus fluoride, nanohydroxyapatite plus fluoride, because they have understood that you cannot really take fluoride out of the system. Fluoride has a lot of advantages, that's for another day, but if you go check out my blogs that I have said what are the advantages of having fluoride, there's a hierarchy of evidences, and the top of the best type of evidence is called as systematic review and meta-analysis. Systematic review is, if my topic is fluoride and its efficacy on protecting milk teeth from decay. If that's my topic, you take all the studies that's been done up till then, and then you evaluate the data and come to a conclusion. That is a systematic review, and about 700 plus systematic reviews have been conducted on fluoride. But all the others, the HAP, the everything, they have got less than, some as less as 10, but less than 50, let's say. And I will put a link again of all the different number of systematic reviews that's been conducted on each of these topics. There is nothing more evidenced than fluoride. All the national guidelines, again, I'm going to put a link to this particular study, which has actually listed all the national guidelines. All of them suggest a fluoride toothpaste. Another thing that you have to think when you hear these dentists say that they're using a fluoride free, or there are a lot of influencers that say go fluoride free, you have to think of your own child's risk. That means, do they have a high risk of decay? Did you have a lot of decay? Do they have a lot of chocolates and sweets? How good are you at their brushing their teeth? Dentists brushing their children with fluoride-free toothpaste is completely different to a non-dentist not knowing how to brush their teeth, brushing their children with a non-fluoride toothpaste. The risk is too high, and I wouldn't recommend it. And for that reason, I'm like I said, I used fluoride toothpaste for my children. It's a cheap and a good option, and there's nothing more evidence than it. So you can buy all these expensive toothpaste. Again, most of the people who are suggesting, the holistic dentists who suggest fluoride-free options, are mostly selling these fluoride-free options as well. And also, if you look at evidence and go back and see, some of the alternatives are most recommended by 1 or 2 dentists in this world. So, you'll see something like, if you look at the people, the authors or the co-authors, you will see the same name repeated, suggesting one particular, alternative. And I really have my doubts if they would not have some sort of financial benefit from these. So I would be very cautious to go against popular evidence-based dentistry of fluoride being efficient. And I just don't understand why adults stop using fluoride. I just don't understand it, because fluoride is a naturally occurring best thing for the teeth, and it causes no damage on adult teeth. So anyways, that is another topic. There's a lot of fiasco about water fluoridation and all that. I'm not going to get into it, but yeah, fluoride does not cause no damage, for like the kind of toxicity damage that was there because of the groundwater high fluoride content does not happen from toothpaste or water fluoridation. So I think I have covered most of the things on fluoride that is on this page. Yes, you don't need that kind of amount of toothpaste. You just need the grain size or a smear amount for children from 0 to 3 of 1000 ppm of fluoride, from 3 to 6 pea-size amount of 1000 ppm fluoride, and for children 6 plus pea-size amount of 1450 ppm of fluoride for normal brushing. So I've given a few examples of toothpaste. So the Humble & Co., one of the ingredients is xylitol. The advantage of xylitol is that it's got a few different properties. So it can actually inhibit the growth of the most decay-causing bacteria called as Streptococcus mutans. So this has been evidenced. Again, it's not greatly evidenced. I will not recommend anything that does not have fluoride. So Humble & Co. has got the fluoride and the xylitol. There is actually good evidence to also show that xylitol is good for making sure that pregnant women use xylitol gum, xylitol toothbrush, toothpaste to avoid to reduce the growth of the Streptococcus mutans so that it's not passed on to the newborn baby. Some of the others is this main silly strawberry that is actually well recommended by a lot of parents because of the good taste. A lot of children like it, so you can try that as an introductory toothpaste. Now these two, the Zendium and the Oraners, these are most of the problems that children have with toothpaste. One is because of the flavor, so the strong mint flavor can be spicy for them. The second is the SLS, or the sodium lauryl sulfate. This is the foaming agent. So you have SLS in hand washing, you have it in detergent, you have it in shampoo. It's the foaming agent which helps get rid of its surfactant. So if you wanted, so there are lots of children who don't like the taste or the feeling of toothpaste, so you can try these SLS free options and the flavor free options. And both are very well recommended. You can try whichever one works for your child. So this is also, there are some children who have got learning disabilities, aspergillosis, and autism, where you can try these toothpaste. I'm just looking at this pro tip. Any toothpaste with 1450 ppm fluoride will work, but they all taste different. So find one that suits your child when they start getting adult teeth in their mouth. It's always about trial and error, so you got to be patient, is what I said in the pro tip. So toothpaste for 6+ is I've given different options so that it applies to people of all different countries. So the Curaprox children's toothpaste, there is no SLS in that, and it's got 1450 ppm fluoride. Then I have advised the HAP. So there is a nanohydroxyapatite, which is also evidenced to be good, but I would always add it with fluoride. The Apacare, again, that's got xylitol and nanohydroxyapatite crystal with 1450 ppm fluoride. This is another ingredient that is also evidenced to work really well, the CPC, cetylpyridine chloride. This is very well evidenced to be used along with orthodontic patients. So it's probably the kind of bacteria that they have, and this has been evidenced to be used as an orthodontic toothpaste. So that's why I put that there. Even gum, the same thing, it's got the CPC, and so I've just given an option just in case it's not available everywhere. The Arm & Hammer toothpaste, that's got natural baking soda. So baking soda has got this property of avoiding, I was discussing in one of the early modules, where the plaque absorbs the calcium from your saliva and starts to go hard to make itself a fort to protect itself from being brushed away. And this baking soda, one is that it can avoid the calcification process. So if there's a child or an adult who calcifies very quickly, you can try this. Again, it's very difficult for me to check it because I don't have that problem where I calcify very quickly. But this is, again, shows some evidence that baking soda is good for people who have a lot of tartar. So that's why I put it there. This is my favorite because one is I love the Curaprox brand. They do they do a lot of research. The Switzerland brand, I love all their products. I was doing teeth whitening along with my Invisalign, and I had a lot of sensitivity. So the one toothpaste I used to recommend for everybody is GC Mousse, and which has got recaldent, but that did not work for me. And then I tried this Curaprox, which has got fluoride and nanohydroxyapatite crystals during my whitening, and it really helped with my sensitivity a lot. And so that is my top pick, as you can see. So the myth buster is that we need to put toothpaste over the full length of the bristle head, which we already said. That's a marketing gimmick, just basically for customers to use up. You just need, even for adults, you need only a pea-size amount of 1450 ppm of fluoride with any of the other adjunctives that you like, and to flavor that you like, and whichever else I'm happy for you all to use. I wouldn't recommend a whitening toothpaste. Whitening toothpaste are very abrasive, but yeah, that's for another day. We will discuss it at some point in one of the modules, but yeah, don't use whitening toothpaste. So that's the GC mousse that's got, again, fluoride. Sorry, it does not have fluoride. It's got the recaldent, which is CPP, ACP. It is also quite well evidenced to help in strengthening the enamel. But this is what's available over the counter, but they also have another version of it called as MI paste, which is the recaldent plus the fluoride, but that's not available over the counter to be used. So this is another toothpaste that you can try if you got a lot of decay and you've tried the other options, but yeah, that's not my favorite. So let us talk about, so this is the GC mousse I was talking to you about. You can use this if children's got a lot of sensitivity, but this does not have fluoride. The MI paste, that's a different version of the same GC mousse from the same company with recaldent, but it's got also fluoride, but that's not available over the counter. That would be my most preferred option. But this is a good one for use in between, like children got a lot of sensitivity, it can be really helpful. We talked about calculus, it builds up at the gum line, we've already talked about that. So there is also an Ora Nurse for adults, so that's got 1450 ppm of fluoride. The Ora Nurse kids have got only 1000 ppm, this has got 1450 ppm fluoride, and again, very useful. It's an SLS free and a flavor free toothpaste, so if anybody wants to try that, then you can try the Ora Nurse. So that's it. We come to an end of module 4, and I shall see you in another module. Take care.